8:15 now. We've been asking you for your pets' names. Dr. B, our friend, Dr. Brent Wallis, Chief Medical Officer of People's Health. Doc, I know you got a couple of boxes. What are their names?
Yeah, I've got Remy, and
Remy?
actually we had JoJo, but we don't have JoJo anymore.
I'm sorry. I thought you had two. I didn't realize. Well, how's Remy doing?
Remy's doing good. He's crazy, like usual, like all boxers.
Well, but that's why we love him, right?
Absolutely.
Well, whether you're newly eligible for Medicare or if you've had it for years, there is a lot to learn about the program, and that's why Dr. B is here from People's Health to talk about 4 common Medicare myths. So, Doc, I guess, what is myth number 1?
Yeah, sure. So a lot of people think that original Medicare and Medicare Advantage plans cover the same services, and actually that's not true. So original Medicare is going to cover all the medically necessary things you might need when you're in a hospital or if you go to your doctor's office or maybe in an outpatient healthcare facility. But what it doesn't cover is those Part D prescription drugs that so many people need, and it doesn't cover routine services for things like dental, vision, and hearing. The Medicare Advantage plans are required to cover all of the services that original Medicare covers, but most of those plans may offer extra benefits as well, and that can include that prescription drug coverage that a lot of people need, and a lot of times they include eyewear, hearing aids. Sometimes they'll have a fitness center membership, and then a lot of them will have a credit that you can use to spend on over-the-counter needs or maybe wellness items.
Are there some other ways that original Medicare and Medicare Advantage plans are different?
Yeah, so original Medicare lets you go see any doctor and go to any hospital that accepts Medicare, and that can be anywhere in the United States. But the Medicare Advantage plans a lot of times will have a more narrow network of physicians and healthcare facilities that you may be required to use. You have to stay in network with those plans. And so Medicare Advantage plans may also require referrals to go see a specialist or prior authorization before you receive medical services or some of the drugs that you might be taking. And that prior authorization means that you have to get approval from the health plan before it agrees to pay towards those cost of services. Original Medicare in general does not require any referrals or prior authorizations.
All right, there you go. Myth number 1, busted. Original Medicare and Medicare Advantage plans do not cover the same services. How about myth number 2?
Yeah, so another common misconception is that if you join a Medicare Advantage plan, you no longer have Medicare, and that is not true. You actually do have Medicare, and you have all those rights and protections that come with Medicare, but your Medicare Advantage plan is actually providing the coverage for all of those services that you need, like the healthcare services, the prescription drugs, et cetera. And so at the doctor's office and the pharmacy, you're going to show them your health plan ID card instead of that red, white, and blue Medicare card that so many people will have.
How about myth number 3?
Yeah, so another thing is a lot of people think Medicare Advantage plans, because they offer some more services, are more expensive than original Medicare. And that's not necessarily true. That's why it's really important to do your research. So every plan is going to have different costs. It's going to have different benefits. So you have to really look at what your overall cost with a Medicare Advantage plan are going to be. They might be lower than your cost with original Medicare. And the reason for that is because Medicare Advantage plans are actually required to limit your yearly out-of-pocket costs. So when you hit a certain ceiling, a certain maximum in the amount of dollars you spend for health care, it actually stops requiring any payment. Original Medicare does not have any ceiling on that yearly expenses, so if you require a whole lot of services, it can get more expensive.
So the sky's the limit.
Exactly.
Okay.
It could be.
All right, let's talk about extra benefits. Do the extra benefits make Medicare Advantage more expensive?
No, they usually don't. They usually provide extra value. So, an example would be here in Louisiana, if you go to get your teeth cleaned, just a routine dental exam, they're going to usually do x-rays. It's going to cost about $220 here. If you only have original Medicare, so that's not going to cover any dental services, you're going to have to pay that full $220 out of pocket. But if you have a Medicare Advantage plan that includes routine dental, you won't have to pay that money out of pocket. You may not have to pay anything at all. So if you look at those extra benefits and figure out if you'll use them, the savings can add up. It's really important to look at kind of what you pay on an annual basis to make sure you're not overpaying for anything.
All right, Dr. B, our friend, Dr. Brent Wallis, Chief Medical Officer of People's Health, is talking about some Medicare myths and dispelling some of them. For example, original Medicare and Medicare Advantage plans do not cover the same services. Medicare Advantage plans are not more expensive than original Medicare. If you join a Medicare Advantage plan, you do have Medicare. That's not true. It's not true that you don't have Medicare anymore. So we'll pick it up here when we come back. 821 Traffic, WWL. At 826, Tommy Tucker, WWL, back with Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. We're talking about some Medicare myths. Doc, do all Medicare Advantage plans have the same costs?
No, a lot of people think that. Some Medicare Advantage plans might have a monthly premium that you're going to have to pay in addition to your Part B premium, and that can vary from plan to plan. And then some will actually have an annual deductible for medical services or medications. And so what that means is you might have to pay a certain amount out of pocket before the plan kicks in and starts covering a lot of those costs. And then Medicare Advantage plans also have different costs for covered services, things you're going to go get, prescription drugs, doctor's appointments. But the costs with those plans most often are going to be more predictable than they are with original Medicare.
And why would that be?
Yeah, so Medicare Advantage plans usually have a copay for any service that you get. So that's a fixed dollar amount that you're going to pay out of pocket. So, for example, going to see a cardiologist may cost you $20. But with original Medicare, the services more often have a co-insurance, and it's at 20% is where it's set. So what that means is if the services, for the physician you see are $1,000, you could pay 20% or $200 of that. And it's going to vary depending on what the doctor does for you, what tests are ordered, and things like that.
I never did get co-insurance because I would be the guy that would be the co-insurer, so I don't understand why they call it that, but they do. How about changing your Medicare coverage whenever you want?
Yeah, you can't do that. You can only change Medicare coverage at certain times of the year. And for most people, the best opportunity is what we call the annual enrollment period, or AEP. That's what's going on right now. That's why you're seeing all the advertisements on TV and hearing them on radio. It started on October 15th, and it lasts through December 7th. And any changes you make during this period go into effect on January 1st.
Is that the only time you can make coverage changes?
In general, it's the time you really need to be thinking about making the changes. It's your kind of one time of year when you can do that. But there are a few exceptions. If you meet certain criteria, you might qualify for a special enrollment period that lets you make changes at other times during the year.
What kind of criteria?
So you might qualify if, for example, you've lost coverage through an employer, like maybe you've retired, for example, or you move outside of the area, the service area where your plan is, so maybe you leave Louisiana. Or if you have certain health conditions, things like diabetes and heart disease, you might be able to enroll in certain types of plan. And there are other ones, but the thing to keep in mind, this is really the important time of year where everybody needs to look at their coverage and make sure they get what they need for next year.
It's very important you get this done before the December 7th deadline. I know you guys got that Medicare Center on Vets. Talk about that, if you would, Doc, please.
Yeah, it's a great opportunity for people to come by and actually talk face-to-face with somebody. It's a Medicare Center located on Vets, right in between Trader Joe's and Causeway. And they'll actually talk about original Medicare. They'll talk about all the plans that are available in this area and available to you. They'll do a side-by-side comparison, and it's a really good way to ask questions because a lot of this stuff is very confusing.
And appointments are welcome, but walk-ins are welcome. Appointments are recommended, but walk-ins are welcome as well. It's 3017 Vets. Thank you, Doc. Appreciate it as always. You can find out more about People's Health at peopleshealth.com, or you can always call them at 1-800-978-9765. It's peopleshealth.com, or call them at 1-800-978-9765. 8:30, time for WWL First News. For that, we go to Ian Ozan.